Hello learners, welcome to week 1 part 2. In the previous week we discussed the physical development. We talked about how heredity, environment and food is important for the development, and also we talked about briefly discussed on the embryonic, the germinal stage, the fetus stage, where we talk about how the child inside the mother's womb continues to develop till the 38 weeks, and also we also talked about how physical development is important in terms of how if you have proper balanced diet, then it leads to a good physical development. Today we are going to talk about functional development, which is week 1 part 2. As I said before, each week will be divided into 3 parts. The first part have been completed, that is physical development. Today we are going to talk about functional development. As the name suggests, functional development, that is how does your body function. So when we talk about a functional development, there are 3 stages of functional development, and they are: number 1, motor development. What do you mean by motor development? When we say motor development, this involves the movement that takes place as pre-heartbeat between the 4th week to the 18 weeks, and intestinal movements that start from the 7th week onwards, swallowing and sneezing, which starts from 16 weeks, and pre-breathing movements which starts from 18 weeks. So these are the various motor development which takes place in the unborn child. You have what is called the pre-heartbeat between which takes place from the 4th week to the 18th week. You have the intestinal movements which starts from the 7th week onwards, and we have what is called swallowing and sneezing, which starts from 16 weeks onward. And then we have what is called the pre-breathing movement, which starts from 18 weeks onwards. Then we have within the motor development, we have what is called perinatal stage. This is just before and just after birth. In the previous discussion, I was talking about the various motor development, the motor development which takes place in the unborn child. Now we come to a stage which is called perinatal stage, and this is a stage which takes place just before and just after birth. And what do we mean by this perinatal stage? Perinatal stage is the separation of the child from the mother when the respiratory and the circulatory independence develop. However, there is still dependence on mother for physical and psychological needs. Then what is postnatal stage? Postnatal is after birth. At this stage, all activities of the body start functioning. That is like the vision which takes place at 4 weeks. You have what is called the head balancing which takes place at 16 weeks. You have holding hands which takes place at 28 weeks, sitting and crawling which takes place at 40 weeks, and standing on feet, that is 12 months. So a child starts to stand, begins to stand at 12 months, that is when he or she reaches 1 year, and the child starts to utter words, that is when he or she is at 18 months, that is at 1.5 years, and then the child starts to control his or her urine or excretion at the age of let's say 24 months, that is 2 years. And during this time, walking is a physical landmark in postnatal stage, that is after birth. When we talk about this particular postnatal stage, talking is intellectual, that depends on physical maturity and emotional relations. Speech and sentences, a child starts to talk in sentences, a child is able to recite a poem, is able to say rhymes at the age of 3 years, and also at the age of 5 years the child is able to socialize. This is the stage when a child is able to, you know, make friends, or you know, enjoy the company of his own age group, that is socialization. And the child is able to appreciate you know, the neighbors if he or she sees them, and is able to talk to them, and so on and so forth, which is socialization, which takes place at the age of 5. Thus, when we talk about motor development, it involves both gross and fine motor developments. When we talk about gross motor skills, it involves large muscle movements. So when we talk about this particular stage, when we talk about the motor development which takes place in this stage, it involves both gross and fine motor skills. Between 1 and 4 years of age, the gross motor skills, that is the large muscle movements, fall into one of 3 areas, that is movement, how the child is moving about, then you know, using stairs and playing. So when we talk about the gross motor skills, that is the large muscles movement, between 1 and 4 years of age, you have the child using these gross motor skills into 3 areas, that is movement of the hand or the legs or the head, and also other movements of the body, then the child using the stairs or playing. So these are the gross motor skills during this stage from 1 year to 4 years. And you have during this stage fine motor skills which involves small muscle movements of hands and fingers in coordination with the eyes. So the hands and the fingers are able to coordinate with the movement of the eyes. So that was motor development. Then we have the next stage of development, or another stage of development, which is called sensory development. It is through the senses that infants discover the world. Sensory development begins during gestation and continues throughout childhood. There are 7 sensory processes. These are taste, that is you are able to taste the food, you are able to make out whether the food is bitter, sour, you know, is hot, and so on. Then you have smell, whether the smell is good or whether the smell is bad. Then you have touch, sense of touch, hearing, seeing, body position, sense and movement sensations. So when we talk about sensory development, these are the sensory development which begins during gestation and continues throughout childhood. There is no sensation of pain before birth. So when the child is within the mother's womb, there is no sensation of pain before birth, but the sensation of touch, the sensation of hot, the sensation of bad smell, and so on and so forth takes place after birth. The pressure and temperature reactions start during 8 weeks in fetus, and severe sensory reaction or expression begins 1 month before birth. Breast suckling is a reunion with mother and gives satisfaction and relief from anxiety. It facilitates deeper and regular breathing pattern. It brings better blood supply to baby's face, develops facial muscles, and imbibes auditory and visual stimuli from the mother. So we say that breastfeeding till at least the first 6 months in a baby's life is very important if the mother is in a condition, because there may be certain medical condition where the mother is not able to breastfeed her child. Then in such situation, yes, breastfeeding, the mother may not be able to breastfeed the child. But If the mother is in a medically fit condition, then we say that there is a saying that it is good to have breastfeeding of the child at least till the first 6 months of the child's life. During the sensory motor stage, the infant knowledge of the world is limited only to sensory perceptions and motor activities. Children utilize skills and abilities they are born with, such as looking, sucking, grasping, listening, and learning more about the environment. So, during this particular stage, this stage involves with what takes place or what can be done with your senses. That is, you look with your eyes, you listen with your ear, you grasp with your hand, or you are able to feel certain feelings of hot, feeling of pain, and so on and so forth. This is the sensory motor stage. So we have already discussed what is the motor development. We have discussed about what is the sensory development. Let me now discuss what is cognitive development. What do we mean by cognitive development? Cognitive development or cognitive abilities allow us to process the sensory information we collect. These include the ability to analyze, evaluate, retain information and recall experiences, make comparisons and determine action. The cognitive stage occurs between ages 2 and 6. Language development is one of the hallmarks of this period. So when we are talking about cognitive development stage occurs during ages 2 and 6, and this is the stage when you have the ability to analyze, you have the ability to evaluate, you are able to retain information, you are able to recall experiences, you are able to make a comparison, and it is during this stage that language development is one of the hallmarks of this period. That is why in a lot of schools, in a lot of societies, children go to school at 3+, because it is when language development has taken place, and the child starts school at 3+, or in some society 4+. But there are some school which takes admissions, which gives admission to children at 3+, because language development has taken place and the child will be able to speak or participate in the class. So language development is one of the hallmark of this period which is the cognitive development. During this stage, children become increasingly adept at using symbols as evidence by the increase in playing and pretending. For example, a child is able to use an object to represent something else, such as pretending a broom as a hose. Role playing also becomes important during the pre-operational stage. So during this stage, you have a lot of role playing. You have children who take the role of the father, who take the role of the pretend to play the role of the father or the mother, or pretend to play the role of the teacher, and so on and so forth, because during this stage they become very adept at using symbols, and also they are able to use an object to represent something. For example, the child may just put on a reading glass to show that he or she is a teacher, or the child may just take a stick and use it as a mic to speak or to perform, and so on and so forth. And like I said, they during this stage, a lot of role playing takes place. Children play the roles of mummy, daddy, doctor, many others. And during this stage, reasoning develops around this age, and children begin to understand words. Understanding begins to shine through a child's eyes as she approaches 4 and 5 years of age, and she recognizes pictures, concept and colors in books. So we always say that, and we say most of the time, even if it's not always, we most of the time say that the first few years of a child's physical development is very important in terms of what value should be inculcated in the child, because when a child is reaches the age of 2, 3 and from the age of 2, 3, 4 onwards, they are able to see what the other person is in front of the other. So it is very important that parents or teachers become a good example for the children to see, for the children to observe, because this is a very crucial stage in a child's life. If the child sees good behavior in front of him or her, with regard to how the teachers behave, with regard to how the parents is behaving, and how with regard to how values are inculcated during this early stages of a child's life, the child will grow up to become a good moral person. So value inculcation, how you develop values in children at this age, that is this early years of life, is very important. Now it is very important to talk about a term which is called eugenics. What is eugenics? Eugenics is the science of improving the hereditary qualities of the progeny or descendants. The term is derived from the Greek word eu, that is EU, which means good, and genes. So when we talk about eugenics is derived from the Greek word EU, which means good, and genes, which means parentage. And it was coined, or this term was given by Francis Galton in 1883, and it is achieved by control of mating or careful parenting. So a lot of times women or men may select their partner in terms of, you say that okay, this person comes from good genes, he has good genes, she has good genes, so she will make a good partner, and so on and so forth. So eugenics is the science of improving the hereditary qualities of the progeny or the descendants. Eugenics eventually refer to human selective reproduction with intent to create children with desirable traits, generally through the approach of influencing differential birth rates. These policies were mostly divided into two categories: positive eugenics, that is the increased reproduction of those seen to have advantageous hereditary traits, and negative eugenics, the discouragement of reproduction by those with hereditary traits perceived as poor. Let me discuss this point again. When we talk about eugenics, eugenics referred to human selective reproduction with intent to create children with desirable traits. So these policies, when we talk about eugenics, these policies are mostly divided into two categories. You have the positive eugenics, where you increase reproduction of those whom you see to have advantage or a better hereditary traits, and you have what is called the negative eugenics, where you discourage reproduction by those with hereditary traits you perceived as poor. When we talk about eugenics, by this time you may come to know that the development of personality starts right from the time of conception or pregnancy. When we talk about development of personality, it starts right from the time of conception and personality, because the genes, the hereditary characters would be taken from the parents or either from the mother or the father. Then the development of feelings at the prenatal stage depends on the feelings of the mother. India was the world's pioneer in practicing social human eugenics. Rig Veda and Atharva Veda contain hymns about fertilization. In one ancient treatise on the subject named as Garbha Panishad. So, when we talk about personality development, when we talk about how personality develop, it starts right from the time of conception or pregnancy, because when you conceive a child, the child either takes the traits of both the parents or takes the trait of either the father or the mother. And when the child is born, he or she is born by taking the hereditary traits of both the parents or either the father or the mother. And we see that a lot of personality development, how a child behaves, how a child performs in life, how a child's personality is also depends on how the parent's personality is. Because during the early stage of a child's life, it is the parents, it's either both the parents or it is either the father or the mother who stays with the child. And so we see that a lot of influence of personality is by the parents, and we see that as the child grows, there is a lot of personality traits which he or she reflects in him or her, and these personality is or the personality which he or she has got from his parents or either his mother or father. So in this particular stage, in this particular week, we have talked about functional development, where we discussed the motor development in terms of how development takes place when the child is inside the mother's womb. We talked about the development of heartbeat, we talked about intestinal development, we talked about pre-breathing movements, swallowing and sneezing. This was the motor development. We talked about the perinatal stage, which is just before and just after birth. Then we have talked about postnatal. Perinatal stage and postnatal stage is the stage within the motor development. And in postnatal development, we have talked about the development after birth, where the child starts to see, the child starts to hold hands, the child starts sitting, crawling, try to stand on feet, and also utter words. And we say that in this particular stage, that is the postnatal stage, learning how to walk is a landmark. Then we talked about sensory development, where the infant discover the world through his various senses, sense of touch, smell, taste, sense of hearing, seeing. All this development is during the early stage of development, when a child sees the world around him with these senses. And we also talked about the cognitive development. Cognitive development is the development when the child is able to analyze, when the child is able to evaluate, when the child is able to speak, when the child is able to talk in sentences, when the child is able to understand the role of his or her parents. And there is a lot of role playing. Children starts to play the role of a teacher, a mother, or a father. And also they know how to use symbols. For example, they would like wear a reading glass to show that they are teachers, or they would just grab a stick and try to sing by using the stick, using the stick as a symbol of microphone. So dear learners, in this particular stage, in this particular week, in this particular part, which is part 2, week 1, we have discussed what is functional development. Thank you so much for listening.